Good day. My name is David DeMarco, and I'm a Medicare counselor in the Office of Aging and Youth in Saratoga County, New York. In this video, we will review how to use the Medicare.gov website to compare Medicare plans. The Medicare.gov website is maintained by the federal government, provides an objective comparison of all available Medicare plans, and is not supported by private insurance companies. We strongly encourage you to use this tool in making your Medicare decisions. At the end of this video, we will discuss how you can get free, unbiased assistance in your community. So let's get started. The first step in the process is to access the Medicare.gov website. So you're going to go to Medicare.gov, and you're going to go to Welcome to Medicare. And what you're seeing now is the main page for Medicare.gov. There are some items at the top you can select. You can get more information about Medicare costs, your rights, reporting fraud. You can get some other information on drug plans and health plans. You can also create an account. And the value of creating that account is once you've entered your prescription drugs, they're saved and you don't have to enter them every time. But for this presentation, we're just going to look at comparing Medicare Advantage plans and other plans. So the first step in the process actually at Medicare.gov is to scroll down a little bit and you're going to click on Find Plans Now. The first thing the system is going to do is ask you what your zip code is. So I'm going to say it's 12866. Continue. And then I can select Medicare Advantage plans or standalone drug plans. It does give you the option of looking at Medigap policies, but in New York State manages Medigap policies very differently. I would not use this website for looking at Medigap policies, but it is very good for looking at Medicare Advantage or standalone drug plans. So we're going to click on Medicare Advantage plan and just say Find Plans. The next thing the system is going to do is say, do you get help from any programs? Do you get help from Medicaid or a Medicare Savings Program or Extra Help? I'm just going to say no, I don't get any help from these programs, and continue. You now can enter your drug costs if you're interested. You're not required to, but the system will estimate your drug costs for the year if you enter your drug. So I'm going to say yes, click on yes, press next. I'm going to enter 2 prescription drugs. The first one I'm going to enter is Xarelto. As you type, you can see that it populates different choices. So I'm going to pick Xarelto. I'm going to press Add Drug. Now, the system's identified that there's actually a generic for Xarelto, but I'm going to say no, I want to keep the brand name. Then it asks me, what dosage do I take? I'm going to keep the 10 milligrams. I can change how often I get it. I get 30 every month, every 2 months. I'm going to stay with 30 every month. Once I've entered my dosage and the frequency, I just say add to my drug list. I'm going to add another drug. In this case, we're going to enter Enbrel. Both are very expensive drugs. So again, as you start typing, you see Enbrel. I'm going to say add that drug. I have various dosages. I'm going to keep the 50 milligram injector. It comes in a pack of 4. I use 1 injector a week, so I just need 1 pack of the 4 every month. So I'm just going to add those, and I'm done. Those are my 2 drugs. I'm done entering those right now. So I'm just going to say done adding drugs. The next thing the system will do is we'll ask you, what pharmacies do you use? Pharmacies do make a difference in costs. Different pharmacies are different for different drug copays. So in this case, I'm going to say I'm going to pick 2 pharmacies just to compare the 2. I'm going to look at enter Walgreens, and I'm going to pick Hannaford. Then in the lower right-hand corner, I'm going to say continue to view plans. Now I'm presented with a list of, you can see here, 33 Medicare Advantage plans that are available in my zip code. They're sorted. You can see on the right-hand side, they're sorted based on the lowest costs for the actual premium and your drug copay costs. So it's sorting that way. There are different ways you can sort, but I'm going to leave it as lowest drug and premium cost. There are also selections you can make here. You can say, I'm only interested in an HMO or a PPO. I'm not going to do that right now. I can select plans that have certain types of benefits. I'm not going to do that. I can just select certain insurance companies if I'm interested. The only thing I'm going to select right now is drug coverage, because some of these plans do not include drug coverage. So I'm going to say yes, I want to make sure I get a plan that includes drug coverage. Now, Medicare does rate all the Medicare Advantage plans. They're given a star rating up to 5 stars. At the time of doing this for 2026, the star ratings are not available. So just for a quick presentation, you can see up here, I can go back to the 2025 plans at the top. So I'm going to jump back to the 2025 plans for a second because the star ratings are available. And if I press star ratings, you can see I can select up to 5 stars. If you want 3 or more stars, you do have to select each of these, not just the 3 stars. So I'm going to say apply. But I'm not really interested in 2025 plans. So I'm going to go back up to the top here and say show me 2026 plans. Now I've got the 2026 plans that are being displayed. And again, you can see there's an Emblem Health plan, a CDPHP plan, an ARP plan, and you would see all the plans like that. What we're presented here is just a high-level summary of plan information. If there's a premium, you would see in this case it's a 0 premium. Medicare estimates your total prescription drug costs for the year for the 2 prescriptions that we entered as $1,894. This plan does not have a health medical deductible, but it does have a drug deductible of $215. All these plans also have a maximum out-of-pocket that you would pay for medical copays. In this case, the cap is $7,500. The caps range typically between $6,000 and $10,000, and that's the most you would pay for medical copays for a Medicare Advantage plan. But in this case, I want to see more details than this for the Emblem Health plan, so I'm going to click on Plan Details. Now I'm presented with more detailed information on this Emblem Health plan. Again, some of the same information is repeated in terms of the monthly premiums. Again, you can see that there is no health deductible, but there is a drug deductible. And as we roll down through this detail, you can see what you would pay for a primary doctor visit copay, what you would pay for a specialist copay, for lab services, for emergency care, if you're admitted to the hospital. These are all the details that you see. You can click on this button to open up more benefits. You can see there's more detailed on group therapy, or opioid treatment, durable medical equipment, and other things. I'm going to click on this and just close that for now. Now, as we keep going down, we'll see the details on the drug coverage for this plan for the 2 drugs that we entered. These are the 2 drugs that I entered previously, the Enbrel and the Xarelto. As I scroll down, what I'm seeing on this page is the total estimated costs for 2026 by Medicare for this particular plan, what I would pay for those 2 drugs. This is a total 2026 cost at Hannaford and at Walgreens. Very, very similar in terms of the pharmacies, in terms of the cost. If I keep rolling down, I'll actually see the same information by month. And you may think this looks strange by month because why is it $900 in January, then it drops down a little bit, and then it goes to 0? There's 2 reasons for that. One, this plan did have a drug deductible, and the drugs that I entered are subject to that deductible. So that means in the beginning of the years, typically January, February, maybe March, I pay more until I've met that drug deductible. Then you wonder, well, why is this going to 0? Well, as you know, there is a cap on prescription copays in 2026 of $2,100. However, that cap is not include just what you pay, but it also includes, to reach that cap, what your plan pays on your behalf. But all you're seeing here is what you're paying. The plan is also paying. So you're actually reaching that cap before $2,100 because your plan is also paying. Now, you may also say, hey, that's a lot of money to come up with in January and February. I can't afford that, and then go to 0. Do I have other ways of making this payment? I'm going to scroll up a little bit. You see this information about Medicare prescription payment plan. What Medicare started in 2025 is a means for you to spread your costs over the year. If you're interested in doing this, you should talk to your plan. If I click on this button, it's actually going to show me on the left side, if I didn't opt into the prescription plan, what I would pay. And then on the right side, it shows what I would pay by month by spreading the costs over the year. You can see it's the same total. It just spreads those costs over the entire year, which is a good option for people who have very high costs, as we're seeing here, for people who have very high costs in the beginning of the year. So then there's more information down below on other benefits, and you can keep scrolling down and seeing all the detail. But I think at this point, what I'm going to do is go back to the summary and show you how you can compare Medicare Advantage plans. Medicare has developed a nice mechanism for this. I'm going to compare the Emblem Health plan. You see this add to compare little box here. I'm going to click on that. That goes into our comparison. I'm going to compare it to the CDPHP plan. Again, click on the add to compare box. Then in the bottom right hand corner, I just push the compare button. Then I receive a nice side-by-side comparison of the two plans. Again, the deductible information, not all the detail that you saw in the detailed plan, but the most important information you get on this side-by-side comparison, what you would pay for primary doctors, what you would pay for specialists, and you can keep scrolling down through this to see the side-by-side comparison. And at the very bottom is a comparison of what you would pay for your prescription drug copays at both of those pharmacies for your drug for each plan. So I'm going to go back up to the top again. It's a very nice comparison. You can print that. If you look up the upper right hand corner, you can print that comparison. I am now going to go back to plan results. One of the things we know at the top of the page, these are Medicare Advantage plans. There are also standalone drug plans. For people who have a Medigap plan, you would need a standalone drug plan that just covers drugs. So I can actually click on this button, switch plan type, and I can go directly right to a comparison of the standalone drug plans by just going to find plans. Now I'm presented with just prescription drug plans. These are not Medicare Advantage plans. These plans just cover drugs. Some of the same information, but you're going to just see drug information. And again, you can click on the plan details to see more detail about each plan. Again, if I want to go back to the Medicare Advantage plans, I can just say switch plan type, Medicare Advantage plan, find plans. Then I'm back to the listing of my Medicare Advantage plans. Thank you for watching this video. The Office of Aging and Youth provides free one-on-one Medicare counseling to the residents of Saratoga County, New York. This counseling is done at our offices in Boston Spa, New York, or over the phone if you are not able to attend in person. Please call 518-884-4100 if you are interested in a counseling session. You can also check out our website for more information. If you live outside of Saratoga County, free counseling is available across the country. Please visit the shiphelp.org website to learn where you can get assistance in your community. Thank you for watching and have a great day.